There is no other sector as healthcare where the core should be human-centric. The fact that Fujitsu adheres itself to human-centric innovation makes possible the transformation of healthcare. For us, mental health is a real issue. Medicine and psychiatry deal with a limited set of data, and based on experience, you diagnose patients, you label them, and you treat them according to that label. As humans, we are very good at integrating some data, but a very limited set of data, and then make decisions. And we call that intuition and clinical judgment. That is useful when you deal with a very limited number of patients. Computers are much better than us at managing large quantities of data.
If we have the opportunity to have a whole information about a group of patients similar to our patient, a specific patient, I think it is very good support for doctors.
With big data and cognitive technologies, we can do things that were not done before.
We have the offer of Fujitsu to help us to answer our questions that Fujitsu understood that were relevant both from the professional and from social point of view.
The Fujitsu solution is an application that takes advantage of artificial intelligence that processes data stored in medical records or healthcare records and can identify diagnosis and risk factors, and it can show the clinician who is at risk of what and what the most likely diagnosis is. Fujitsu solution gets there, over 95% of accuracy when compared to 8 experts, 8 psychiatrists with more than 20 years of experience. It's very preliminary. What we're doing is still experimental, but clearly it's going to be key over the next 20 years. If the solution works and we can scale it up and make it work for clinicians on a daily basis everywhere, we will save time that clinicians can devote to do human things, like taking care of patients personally. Fujitsu is extremely well positioned to implement human-centric innovation in healthcare to disrupt the way we practice medicine today.